forward to welcoming you to our hospital's international courses.
We are delighted to launch the first international educational program series at Imam Reza General Hospital, Tabriz, Iran.
Tabriz is a historical and vibrant city.
You will love our beloved city.
Join us for our educational programs.
We'd love to have you here.
Waiting for nice days together.
See you soon!
Hello everybody. As you may know, we are here to talk about the international educational programs of Imam Reza Hospital. Today we are here to talk about the international course of Dr. Shams Vahdati. He is a professor of emergency medicine in emergency department of Imam Reza Hospital. Welcome, dear Dr. Shams. We are here to talk about your program, as I know the course that you will introduce is about neurovascular emergency. We hope that we can provide an overview about what the participants will gain in this program and what will be covered in this course.
Thanks. It's an honor for me to be in this program. As you said that I'm Professor Shams Vahdati. I'm head of emergency medicine research team, research center, and also I have some kind of expertise in emergency neurovascular. Then we provide and we decided to have some courses to improve the students or the faculty members in evaluation of the stroke patients who came to our emergency department. Also, for 10 years, we are working on stroke patients management from the pre-hospital up to final diagnosis and treatment of them in the stroke center, and also after that, the rehabilitation of these patients. Thus, this collaboration between our department and the neurology department, especially the neurovascular team, we are going to improve our treatment algorithms and also our management, and decreasing the time of the event up to treatment like fibrinolytics or cath lab. This improvement is some kind of gold standard of our team. Then we decided to provide some courses, short or long courses, to improve the abilities and knowledge of the participants. Because of that, we tried to answer 3 parts of questions. One of them in the neurologic examination questions that maybe participants think that how I can examine the patient, and how do I do a full neurological examination on the patient's especially when the emergency department mostly is crowded, and we have most of the patients waiting for visiting and treatment process. Then how can I examine these patients? Then how can use some procedures? Maybe we want to request some tests, especially neurological tests. Then for deciding which patients must be admitted to wards or maybe in the waiting in the under observed situations, and something like this. Therefore, we divided course in 3 parts: neurological exam, then diagnosis, and after that, the post-diagnosis and treatment.
Great. As I know, yes, you've done great jobs and you have great achievements regarding the management of patients with stroke. Now let's talk briefly about the objectives of this course. As you said, you've divided to 3 parts the objectives. Can you talk about each part?
Of course, yes. The neurological examination. We have some questions like, how do I do a full neurological exam on patient when I have 7 other patients waiting to be seen? How do I know what to priorities? What's the current best workup for subarachnoid hemorrhage? Do we really need to LP everyone? What's the current best inpatient workup for stroke? How do we treat them, and what testing needs to be done urgently? What's the current workup for coma? How would I know if the patient is not recoverable or brain dead? Also, what's reversible cerebral vasoconstriction syndrome, and should I be looking for this? In second part, about diagnosis and imaging, we must answer these questions that I'm not a radiologist. What I am looking for on a head CT or MRI? When do I really need to order imaging for someone with headache? What kind of brain imaging do I need to order? And what am I looking for on it? How can I use point of care of ultrasound? How do I know which headache and vertigo patients need neuroimaging? What are the right tests to order for potential stroke? When do I order CTA, CTP, MRI, or MRA? After finishing this section, the last one and the third one is post-diagnosis clinical decision making. We must answer to these questions. Which patients are candidate for endovascular stroke treatment? What do I do with patient who might have had a TIA? What's the current status of thrombolytic in stroke? And what do I do when I find a cerebral aneurysm? What should I do with my intracerebral hemorrhage patients? How do I treat my patients with a carotid or vertebral artery dissection? What do I do with my patients who has dizziness? What do I do with these patients whose underlying neurological disorder seems to be getting actually worse? And which patient with subdural hematoma needs surgery? When we complete the course, the participant must answer to all of these questions. Then we can say that this questions is acceptable and provide our participants well.
It's great. You completely described the objectives of this course. And let me know who are eligible to participate in this course. I mean, who are your target audience?
Of course, the emergency physicians in each level, like general practitioners who are working in the emergency, and the emergency specialists Also, the students like resident of emergency medicine, neurovascular, neurology residents or neurology specialists, and some kind of interested participants in neurosurgery department, maybe the professors or students of neurosurgery. All of these participants can be in our course.
Thank you very much. Now I want to talk about the highlights of your course, the key concepts, and also the duration of your course. How long will it be?
Our course is for 6 months. This is a short course. If we want to design it for a complete course, it maybe lasts for 2 years. But in a short course, we have the participant must participate for 6 months. As you know, the stroke is the most problem in the societies because of time-consuming and cost-consuming. Then we try to improve the management of these patients as soon as possible. And we try to shorten this period of the event to treatment and choosing the best way of the treatment of these patients and promote the knowledge of all these cycles workers who are working in the per-hospital up to discharge of these patients. Then we suppose that these participants must rapidly diagnose these patients and catch them and do the best tests and imaging and also choose the best way of the treatment and finally planning for the out-of-hospital rehabilitations and so.
Okay, great. Thank you very much. And can I know about your expert team and who are your colleagues in this program?
We are 4 faculty members. 2 of our teams are emergency specialists and 4 of them are neurologists. All of these 4 have more expertise in the stroke patients and have a long time courses about management of the stroke patients. Professor Farhudi and Professor Sadeghi Hokmabadi are our neurologists with specialty in stroke management patient. From the emergency department, me and Professor Ala, we have some courses for improving our expertise in neurovascular emergency from abroad, and we are working together nowadays in emergency department in managing these patients.
Thank you very much. If there is any other thing you want to talk about, we will be glad to hear it. If no, I would like to appreciate your participation in this program, and we hope that you will have great courses about these patients.
I want to say that this way of internationalization of the courses and collaboration between our hospital and the other hospitals and other universities would be the point of improvement and promotion of knowledge in these areas.
Thank you very much. Thank you very much for your attending and for your participation in the program. If you have any other question, please contact our team, and you can also visit our website. Thank you very much.